today's video, I thought I'd come on and talk about 5 top tips in pregnancy that I've come across as a midwife. So the first top tip is eating healthy and taking your vitamins. Eating well during your pregnancy is very important as this will help your baby to develop and grow. To do this, you should include a variety of different foods into your diet as this will give you a balance of different nutrients that you and your baby need. There is a misconception sometimes that you need to eat for 2, but this really isn't the case. Whilst you need to increase your intake a bit, it's important not to overdo it, especially with sugary foods, as this can increase your risk of gestational diabetes. Most of the vitamins that you need during your pregnancy are in the foods that you eat, so it is recommended to have plenty of fruit and vegetables in your pregnancy, and also to include fibre into your diet. A common symptom of pregnancy is constipation, and by having fibre in your diet, it will help with this. There are also foods that you shouldn't be eating during your pregnancy, such as raw fish and liver. However, I do want to go into more detail about foods that you should and shouldn't be eating during your pregnancy, so please do watch for this video coming out soon. If for any reason you feel like you are unable to or finding it very difficult to follow a healthy diet, then please do contact your local midwife or local doctor, as they may be able to make a referral to a dietitian to help you. It is also recommended to take folic acid and vitamin D supplements during your pregnancy. The reason why we advise you to take folic acid is because it can decrease your baby's risk of major birth defects, such as neural tube defects, which include spina bifida. If you are pregnant, folic acid should be taken as soon as possible up until the end of the first trimester, which is 12 weeks of pregnancy. If you have any medical problems, then do discuss this with your local doctor, as you may need to have a higher dose of folic acid. For example, if there's a family history of neural tube defects, if you have epilepsy, or if you have diabetes, so please do confirm this with your local doctor. Vitamin D is also a very important vitamin to take during your pregnancy, and also if you are breastfeeding, as this will help your baby to develop healthily. It is also important to be aware not to take any vitamin A during your pregnancy, as this can be very harmful to your baby. So my second top tip is consider having your vaccinations. It is recommended to have the whooping cough vaccine. Whooping cough is a highly contagious respiratory infection that can develop into coughing bouts. This condition can be harmful, particularly in young babies. Therefore, it is recommended to have this vaccine during your pregnancy, as it will provide protection in baby's early life. The best time to have this vaccination is from 16 weeks up to 32 weeks of pregnancy, as this will give time for the antibodies to transfer over to baby to protect baby in its early life. It is also recommended to have your flu and COVID vaccine, as having these during your pregnancy can make you feel very unwell and it can cause complications to arise. So my third top tip is to observe your baby's movement. Feeling movement of your baby is a reassuring sign. It is likely that you'll start feeling your baby move between 16 and 24 weeks of pregnancy. However, if this is your first baby, it may take a bit longer to feel baby move. It's really important to be aware of your baby's movement and get to know the pattern of your baby's movement. If at any point during your pregnancy you feel like the movements are not as much as usual, or if the pattern has changed, or if the movements have stopped altogether, then you must go to hospital immediately to be checked out. My fourth top tip is to look after your mental health. I do feel sometimes mental health is unappreciated during pregnancy compared to physical health, but both are very important. When you are pregnant, it is an experience that will make you feel all emotions, and it's okay sometimes to feel low. You'll also experience mood swings, and this can be normal. If you feel like your feelings are becoming overwhelming or persistent for over 2 weeks, then please do seek medical advice. There are always healthcare professionals that are available if you have any mental health concerns. And my last top tip, which is the 5th top tip in pregnancy, is to be active during your pregnancy. Being active during pregnancy has many benefits. It can improve your mental health, it can help you rest better at night, and it can also improve your general health. So were you active before you got pregnant? If you were, it is advised to continue to do the same level as what you were doing before you got pregnant. If you didn't do much exercise before pregnancy, it is advised to aim for about 30 minutes each day. It's important to listen to your body, and if you feel like you're doing too much, then do slow down. Exercise in pregnancy is safe and healthy to continue, but there are some exercises that you should not do. So, some examples of sports that you shouldn't do is contact sport, such as rugby, football, kickboxing or basketball, because there is a risk of your bump being hit and causing abdominal injury. You should also avoid activities with the risk of falling, such as horse riding, climbing or skiing. As your bump is growing, this will alter your centre of gravity, which can make it a lot harder to balance. It is also important to avoid exercising on your back. As baby's weight increases and your uterus is getting bigger, this will put a lot of pressure on the major blood vessels, and when you are lying on your back, this will restrict the blood circulation to go to you and your baby. This can then lead to make you feel faint, dizzy, or even make your blood pressure drop, especially after 16 weeks of pregnancy. So do keep this in mind when you're exercising. As part of your exercise, I would also recommend for you to do your pelvic floor exercises, as I'm sure your midwife has already told you. When you're pregnant and during childbirth, these muscles are under a lot of strain. By strengthening your pelvic floor muscles, this can help to reduce or avoid stress incontinence after pregnancy. If you have a weak pelvic floor, this can cause you to leak urine when you cough, sneeze or strain. And so that's all my 5 tips. I really hope this has helped you. Please like and share my video, it means a lot. And if you could also subscribe, it really does mean a lot to me. I just want to help as many people out there as I can. Thank you so much for watching, and I'll see you in the next video. Bye!